wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I'm pleased to have with me a longtime friend and a guest here at the Hotze Health and Wellness Center, Mike Chinni. Mike, thanks for joining us today.
Well, thanks for having me, Doc. We're here talking about knees and regenerative joint treatment today.
Right. Now, let me just tell you before we get into this, Mike and his wife, Becky, but Mike particularly, has been a guest or patient of mine for the last 40 years, since I was over on the North Freeway.
Yes.
In fact,
I was here before it was the Hotze Health and Wellness
That's
Center.
right. So I'm glad to have you. And Mike came in initially, you had problems with asthma.
Yeah.
And we treated him for allergies, and I think your asthma is pretty much under control, isn't it?
It very much is. And frankly, I don't want to butter you up or anything, but I credit you for saving my life.
Well, I remember when you were in the hospital in San Antonio and they were giving you corn.
Yes.
Oh, my gosh. You were getting a corn-based IV fluid, and we knew that was going to cause a problem. And in fact, it almost shut your lungs down there, didn't it?
Oh, gosh, we have to get into this. Okay. We were out here in Katy, and I was having a very serious asthma attack.
Right.
You were out of town. I think you were over in Georgia someplace. Yeah. I'm not sure. And I am now at this point, I'm diagnosed with having fructose and lactose allergies that were triggering my sinus problems and my asthma. And I'm having this serious asthma attack. They've admitted me into the hospital, and they hooked up a IV bag of fluids. And I looked at the bag, and it said dextrose. And I said to myself, I'm allergic to fructose. I'm allergic to lactose. Dextrose can't be good for me. And that's the last thing I remembered for 3 days. When they took me out of the induced coma and intubation, I ended up in the hospital for 2 more weeks. And I got through that, thanks to God and my wife. And we started working on eliminating all of the corn and corn derivatives.
Right. So no more corn on the cob for you, huh?
No, sir. No, sir. The truth of the matter is, after all this time, I probably would tolerate that.
Right.
But I have adjusted my lifestyle so much that it's second nature to avoid Doritos and corn on the cob, which frankly is roasted corn on the cob is still great. But we've gotten past most of that.
Right. So Mike has been a long-time guest, and his wife worked on our staff in the accounting department, so they're longtime friends. And Mike came to me about a year ago complaining of a knee problem. Left knee was bothering him. And tell him your history about knee problems, because you had a right knee problem years ago.
Yes. I've had, at least my right knee was bad since high school. I got banged up in high school football pretty bad. And it was so bad that in 1974, I didn't have a knee replacement. I had torn a meniscus, and they took out all of it, which is what they did back in 74. Mm-hmm. Told me, just keep your leg in shape and everything will be fine. Well, that didn't work out quite well, but it did last for, 25 years almost. But in 2008, in August, we took our oldest grandson to Washington, D.C. for a week. And the second day out, we walked up Capitol Hill from the mall. And I got about 2/3 of the way up there, and I said, honey, I can't do this anymore. And we had rented a car, and for the rest of the week, I drove them around Washington, D.C., dropped them off, went someplace and parked or drove around some monuments and went and picked them up again. When we got back to Houston, I went immediately to a surgeon and said, I think I need something done. And yeah, he replaced the knee, which honestly, I wouldn't recommend to anybody unless you absolutely needed it. It was pretty much 6 months of hell afterwards. And last year, I started to notice that my left knee was starting to act about the same that my right knee was acting before we went to DC. And you had put out some flyers and some notices that you were doing regenerative joint treatment. And I weighed the two real quick. One is regenerative joint treatment going to be better than having my knee replaced? Answer, yes. And so I called up and said, hey, I think I want to have this looked at. Y'all evaluated me, did some x-rays.
We did an
MRI, yes.
Right.
And decided that I was a candidate. And
because you had degenerative arthritis in that knee. And it was severe.
But it wasn't hurting that much. It was just those little twinges that I'd get every now and again. And so I decided to go ahead and go through the treatment. And we had our first shot. I wrote all this down so I wouldn't forget because I'm terrible at dates, on the 7th of November in 2024. And it was the A2M injection. Healing factors pulled out of my own blood.
A2M is alpha-2 macroglobulin. We get that by drawing blood, spinning the blood. Alpha-2 macroglobulin are large molecules made in the liver. They don't get into the joint space because they're so large. But what they do, by injecting them into the joint space, it neutralizes the enzymes, protease enzymes, that are eating away at the cartilage. So it stops the inflammation. And so we did that twice on you, I believe.
Yes. Well, the first time did really well. And I made a mistake of, before getting the Super Vesicle treatment, or before I even thought to ask anybody about it, I took on a little construction project for a friend of mine's boss. And it involved a lot of climbing up onto scaffolds and climbing up and down ladders. And after 3 days of that, I finished the job and I said, I think I need some help. So I called up and Jason looked at me and said, yeah, you need another shot before we do the super vesicles. So we did that, and I was very careful not to overstress myself, and I took very good care of me for 6 weeks until the end of March, and then I got that. And this was, the last shot was on the 26th of March, and just this past August, at the end of August, we took two of our last grandkids to Washington, D.C. for a week and a half, walked up and down stairs, walked up to the Lincoln Memorial a couple of times. We logged at least 5 miles a day, sometimes 7. And you know, Washington, D.C.
Sure.
is not flat like Houston.
No.
There's a lot of elevation. And I was just great. And 2 years ago, we went. And at the end of the day, I was not just hurting, I was sore all over, because I was walking different, and it really hurt, and I was basically sitting in a chair when we got back for about a week to recover.
So we came in and did the 2 alpha-2 macroglobulins, and then we gave you the Super Vesicle, which is derived from placenta, from the umbilical cord that's attached to the placenta in children born by, or babies born by cesarean section, whose mothers have not received the COVID injection. So, and it contains some very important nutrients plus stem cells, and those stem cells help regenerate the cartilage in your knee. Now, on a scale of 0 to 10, 0 being where you were, 10 would be a completely normal knee. How would you rate your knee right now?
Right now, probably an 8,
Okay.
maybe a little bit better. Uh, Again, I have a tendency to dabble in construction work, and our parsonage needed a pantry built, and of course, I raised my hand and, hey, Becky and I will build your pantry for you. And that involved a lot of overhead work. I First day, I did a lot of climbing up on the ladder, and I had worn some old beat up shoes because I knew I'd be putting some sheetrock mud and raising a lot of dust. I didn't want to wear my better ones. And that night, my knee hurt quite a bit. And I was kind of afraid that, oh, Mike, what did you do? Did you screw the whole thing up? Well, the next morning, it was fine again. And I wore my better shoes the next 2 days, and it was totally different because my weight was balanced better. These are actually the shoes I've got are much better. I got them they're for hiking from REI,
Right.
and they're much more comfortable. And I don't really want to get them dirty, but I did anyway. But my knee was just fine after that. Same with my right knee.
Well, this is an important point. Back when you had your right knee problem and you went to the doctor initially, as I read your history, he gave you cortisone injections and various things like that. By the way, cortisone does not restore cartilage. As a matter of fact, it will inhibit the regrowth of cartilage. So invariably what happens when you go to an orthopedist who does knees, their goal is to replace the knee. I mean, that's what they're in the business of doing. So they'll give you cortisone shots, and they'll give you that maybe every 3 months or so. And then finally they go like, look, it's not going to work out. You need a knee replacement, right? And that's what he told you. And you had about 20% of the people that have knee replacements or hip replacements have complications. And, some of them are long-term that they get infections. Some of them, they have to get the knee replaced again. You have all kinds of problems with it. So having your knee amputated is not the solution. What my opinion is, and we practice it, we do regenerative therapy, and that's where we evaluate the joints using MRIs to see what kind of damage is going on in the knee, whether you have problems with cartilage, whether it's degenerative arthritis with loss of cartilage, whether you have ligament strain or meniscus, torn meniscus, or torn ligaments. That's what we look for. If it's degenerative arthritis with loss of partial or loss, even bone on bone, you still have cells in your bone structure. You still have cartilage cells. And what the A2M does is it stops the enzymes, protease enzymes, from eating away at the cartilage. And then the stem cells from super vesicles stimulate new cartilage growth. Now, is this a permanent fix? It may be that periodically you may have to come back in and do that again. You may have to come back in and get an A2M injection again. We'll just see, and you've got to manage that. If it begins to worsen over time, you can come back and do that. That doesn't mean you're going to have to get a knee replaced. And you prefer at your age not to have to do that.
No, I don't. I don't want to have that done. I had heart surgery 10 years ago, and I wouldn't want to go through that again.
I wouldn't wish it on you either. We want to keep you healthy and well, my friend. So, Michael, you've been coming and seeing us and our providers here for the last 40 years. How would you express your evaluation of the Hotze Health Wellness Center and the staff?
Just to quickly put it on a scale from 0 being terrible to 10 being fantastic, I'd put it at a solid 10. I have friends who when they go to see their doctor, I had one in particular would go in, the doctor would come in, and he would the guy would get on the doctor's stool and slide over to the door so that the doctor wouldn't be able to get out until he got his questions answered.
Yeah, the average doc spends about 5 to 10 minutes at the most with an individual, their patients. And we focus right here. We do believe that we are ministers under the authority of God and Christ, who's the great physician, and we're his hands and feet. And our goal is to help our guests, whether they have joint problems, whether they've got allergic problems, whether they got low thyroid or sex hormone problems. Our goal is to help every one of our guests to get on a path of health and wellness naturally, so they have energy, vitality, and enthusiasm for life. As you get older, everybody wants to live longer, but a lot of times people live longer and they get sicker and they don't do well. I've just finished a book called Healthspan, Living Long, Living Well, and that's called Healthspan. So the whole goal is to help people as you live longer to live healthy so you can enjoy life. And that's what we do with regenerative therapy. And so Mike is an example of one of the guests we've had here that's we've employed regenerative therapy on his knee to help him so he can function again without having to go get another knee.
And, you can't do any of that. You can have all the technology in the world. You can have this beautiful facility that you have built. You can have the greatest doctors in the world. But if they don't listen to their guests, to their patients,
right,
it's not going to work. I do go to other doctors. I go to a cardiologist.
Right.
I go to an orthopedist. I go to a dermatologist. And all of them are trying to put me into a box so that their predetermined treatment regimen will work on me. And that's not the way it's done here. A lot of these doctors, if I see him for 15 minutes, he's going to talk for 10. I'll talk for 5 if I get that much out. When I see Dr. Ellsworth, it's the exact opposite. He listens way more than he talks. When you were seeing people, you listened, and that's what's important. Because just because my blood work says that my thyroid is normal doesn't mean that my thyroid is normal.
That's right. Doesn't mean you're getting enough thyroid into your cells. You can have normal blood work because the normals normally fall within a range of 90% of the population will fall into the normal range. Well, you don't want to be in a normal range. You want to be in an optimal range with your hormones, where they were when you were younger. So that's how we evaluate our guests first and foremost, is by listening to their clinical symptoms and our physical examination. We do blood work to look at that, and we always want to keep things within range when we're treating, but the blood work doesn't determine our treatment primarily. It can point us in a direction, and we always follow up with blood work whenever we treat to make sure we keep everything within a range of normal. We don't want to get out of normal. Well, Michael, thank you for giving us the privilege of serving you for 40 years. And thank you for letting us serve your family all these years. And if any of you have problems with your joints, knees, hips, shoulders, please don't hesitate to give us a call here at the Hotze Health and Wellness Center. We'd like to help you overcome those problems without having to amputate a joint. We'd like you to have a natural course so you could repair your joints naturally. And if you'd like to do that, just give us a call here at the Hotze Health and Wellness Center. Michael, thank you for coming in and visiting with us today.
Thank you for having me.
And thank you for your friendship.
And yours too.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.